to start with probably my favourite memory and favourite experience on the Nurse First programme, which was about a year ago when Sharon D'Agostino, who is our Vice President of Corporate Social Responsibility globally and Head of Citizenship, was visiting the UK. She was on her European tour to look at the different partnerships that Johnson & Johnson get involved with all across Europe. And we had the opportunity, myself, Sharon, along with a few other members from J&J, to meet 4 of the first cohort from Nurse First. I know some of them are here today, and Dave and Agnes, to hear about some of the projects that they were working on, and importantly, how they were being developed through the process. And we had an absolutely fantastic afternoon. I remember coming out of that meeting completely buzzing. We were all on such a high, so inspired by the work that was going on. But I'll never forget it because Sharon literally grabbed my arm and she said, "Look, Rhoda, I travelled all around the world to see many different things happening all around the world. And she says, I know I'm going to meet a group of people somewhere who have the ability to change the world." And that's what I saw in that room. Those Nurse Firsters, they're the kind of people who really can change the world. And I really, from having been part of this programme for the last 2 years, I really completely agreed with her, and really this is what we're celebrating today. We're celebrating you guys and the fantastic work that you've done over the last few months. So what I want to do is just spend the next few minutes talking about why this is important to us as Johnson & Johnson, why we invested in this programme, and why do we want to continue to keep on being invested in this programme. And there's 3 main reasons, which I'll just go through. First is our credo. This is our company mandate as J&J. It's effectively the essence of who we are as an organisation. And what the credo talks about is responsibility. And it calls us to outwork 4 clear responsibilities. First of all, to our customers, to our employees, to our communities, and to our shareholders. And I'm just going to pull out 2. Our first responsibility is to doctors, to nurses, to patients, to meet their needs with the highest quality. And our third responsibility is to the communities that we live and work in, and to the world community as well, to help better health and education. And so really supporting the Nurse First programme, we see that as a direct response to who we are as an organisation, to help get alongside and develop nurses, clinicians, healthcare professionals, those who are at the front line delivering healthcare within their communities. We believe that this is absolutely a response to who we are as an organisation. Secondly, as an organisation, we are really passionate about innovation and passionate about investing in healthcare innovation. In this day and age, particularly where we're in a season of recession and public spending cutbacks, we believe that now more than ever is the time to innovate. It might seem safe to do what's already been done before, but actually we're all being asked to do more with less. And this is the time to really innovate and get behind those programs and those projects that are really innovating within this space. We see that Nurse First really aligns powerfully to that approach. And thirdly, why we're really behind this programme is collaboration. There's a quote from Darwin there himself: "In the long history of humankind, those who've managed to collaborate and improvise effectively have prevailed." And we see a future, a healthcare future, that lies in integrated solutions that cross the boundaries of business, of government, of society. We believe that that's where the future is. I've heard it described before as horizontal relationships, horizontal partnerships that can bring different partners, different elements of expertise around healthcare together to truly make a difference. So we continue to be really proud to support this programme. Myself, along with many of my colleagues here, some of whom are directly involved in coaching, some of you I know have really benefited from being involved, and I hope that that's been the same for you as well. And we're really expectant, as Dave and Chris have said, about what the future will bring, that we believe that this is the start of something great, and as it grows and scales, we want to get behind you and support you within that. But what I do want to, the most important message today is really to say a huge congratulations and thank you to all the Nurse First participants to Cohort 2. I have been so inspired from what I've seen and from what I've heard so far, and I know there's more to come. And I just think you're truly amazing, and just want to say a huge congratulations to you all. Okay, thank you.